My great pleasure to introduce our next speaker, who is an excellent addition to the research crew here at UBC. Dr. Murray DeMarco is a associate professor in laboratory medicine, works out of St. Paul's Hospital, and we're very excited about the work that she's been doing to introduce spinal fluid analysis to help us understand the changes that are happening in the brain and how that can influence clinical care. Please go ahead, Marie.
Thanks, Dean, for the introduction. I hope you can see my screen all right. I'm pleased to be here online to be able to talk to you about some of the work we're doing to try and measure changes in the brain occurring with Alzheimer's disease and catch those things early to help with earlier and more accurate diagnosis. So we're going to talk about a test for measuring Alzheimer's disease changes in the brain, and we're going to go over exactly what it is we're measuring, what the results mean, and how they're used, as well as who should and who should not get this kind of test. So to anchor the discussion, let's first talk about what a biomarker test is. So a biomarker is a substance floating around in a body fluid like blood or a tissue that tells us about health or disease state of an individual. So if we take an example you might be familiar with or have heard about, would be a test for diabetes. So in this example, the purpose of the biomarker test is to measure the ability of the body to regulate glucose levels. So to perform the test, we take a sample of fluid, in this case blood, and we measure the biomarker glucose. And how little or how much glucose is there tells us a little bit about our body's ability to regulate glucose and a little bit about diabetes. So with that, we'll switch gears back to Alzheimer's disease. And in this case, we'll again look at what would be the purpose of this test. Well, the purpose would be to try and measure the changes that are happening in the brain as a result of Alzheimer's disease. And to do that, we have to select some type of fluid or tissue. Well, brain tissue is a little hard to get at. What we can get at is the fluid that surrounds the brain. This is called cerebral spinal fluid. So the brain sits in sort of this pillow of fluid called cerebral spinal fluid. It also flows down your spinal cord. And so we can get access and take a little sample of this cerebral spinal fluid. This fluid, of course, is in direct contact with the brain. So it actually gives us a picture into what's happening in the brain. And now we have to pick our biomarker. So how are we going to measure these changes? So let's go back to what's happening to the brain as a result of Alzheimer's disease. So here we have our healthy brain cell. But over the course of Alzheimer's disease, there's some changes that take place. And these changes can happen even before symptoms occur. We have this tau protein that was mentioned earlier that aggregates or clumps together to form what we call tangles. We also have this other protein that also clumps together and forms aggregates, which we refer to as amyloid plaques. And together these things are the hallmark of what's happening in the brain as a result of Alzheimer's disease. Okay, so we know what's happening with the brain with amyloid and beta. So let's also look at amyloid beta and tau in the cerebral spinal fluid and see what happens to them. So we know in the brain amyloid beta and tau form these clumps. What we find in cerebral spinal fluid as a result of Alzheimer's disease is amyloid beta actually goes down and tau goes up. So there's less amyloid beta and more tau compared to people who don't have Alzheimer's disease. Now, amyloid beta is forming these plaques in the brain, and those tend to act like sponges and sop up all the amyloid beta that's floating around in cerebral spinal fluid, causing it to decrease in cerebral spinal fluid. On the other hand, as those brain cells die, tau is released into the cerebral spinal fluid, so that increases the amount of tau. Of the two biomarkers, amyloid beta is really key because that's more specific to Alzheimer's disease. and the changes that occur as a result of Alzheimer's disease, we really only see that lowering primarily in Alzheimer's disease. Tau, on the other hand, increases when brain cells die. So that cause of brain cells dying or being damaged or being inflamed doesn't have to necessarily be due to Alzheimer's for tau to increase. But taken together, those two biomarkers are complementary and tell us a little bit about what's happening to the brain. So now we know what biomarkers we're going to measure, but what do the results mean and how are they used to arrive at a diagnosis? Before we go that far, first we have to understand a little bit about test performance. So how good a test is at actually making a diagnosis or identifying something in particular, in this case, Alzheimer's disease. So to do that, we're going to imagine this biomarker test that measures whether or not you like country music. And because we think your ability to like or not like country music has to do with the chemistry in your brain, just like our Alzheimer's disease test, we're also going to look in cerebral spinal fluid for biomarkers because we think that's going to be the most informative. The biomarker we're going to measure in honor of our Canadian country fans out there is going to be called the Twain protein. So in this biomarker test for whether or not you like country music, we know that those with very little amounts of this Twain protein floating around in cerebral spinal fluid do not like country music. On the other hand, those with a lot of the Twain protein floating around in their cerebral spinal fluid tend to be lovers of country music. And how do we know this? We know this because we took a group of people we know that do not like country music at all, and we measured their Twain protein in CSF, and we found that they had very low levels. We also took a group of people who like country music, and when we measured the amount of Twain protein in their cerebral spinal fluid, we found that they had very high levels of this protein. And you can see here these things group nicely together, so we can actually draw a line and say that anyone above this line, or this amount of Twain protein, is going to be a country music lover, versus everyone below this line is someone who does not like country music. This is an example of a perfect test, right? You can easily separate these two groups. And while there are some tests in real life that work like this, that's not always the case. More commonly, we have something that looks like this, where the groups are a little closer together and there's some overlap right at the edges. So this is more commonly how biomarker tests perform. And in this scenario, we can still know a lot about whether you likely like country music or not. If you're this person over here with a high amount of Twain protein, we're still very confident that this person would be a country music lover. If we go over to this person over here who had a very little amount of Twain protein, we're still very confident that this person would not like country music. But if we have this person here in the middle, we might need to gather a little bit more information before we decide if they're a country music lover or not. So we may talk to their friends and family. We may look in their closet to see if they have some cowboy boots in there. Anyway, so we take all that information and then make a decision about whether we think they're a country music lover or not. So then, now that you got a feel for test performance, let's go back to Alzheimer's disease testing and our question about what the results mean and how they are used. So if you remember, we have our two biomarkers, amyloid-beta and tau, and we know generally what they do in Alzheimer's disease. If we look at these groupings of people and how they separate by the key biomarker here, amyloid-beta, we have a plot that looks similar to what we saw with the country music lovers, right? We get pretty good separation of the groups, and this is trying to represent, actually in real life, how this test works, right? We get pretty good separation of the groups, but there's some overlap. In the orange are people we know have Alzheimer's disease, and they tend to have low amyloid beta levels. and those without Alzheimer's disease tend to have higher amyloid beta levels. So when we measure amyloid beta, and let's pick one individual here, and we measured their amyloid beta and found they had very low amyloid beta. This concentration of or level of amyloid beta is consistent with the changes that occur in the brain as a result of Alzheimer's disease. If we take another person and measure their amyloid beta and find a higher level of amyloid beta, this is not consistent with the changes that occur as a result of Alzheimer's disease. And like in our country music example, if we get someone here in the middle with a moderate amount of amyloid beta, we're going to need a little bit more information before arriving at a diagnosis. One of those additional pieces of information we can add is the tau protein. And we discussed earlier how this protein is not necessarily specific for Alzheimer's disease, but increases when there's any sort of damage or inflammation to brain cells. And because of that, you can see that the groups are a little closer together, so there's a little more overlap here between those with and without Alzheimer's disease. But a high tau does tell us some more information of whether that signature or those biomarkers floating around in the cerebral spinal fluid are consistent with the changes that occur with Alzheimer's disease, or if they're not. So what do the results mean? Well, you can see how taking amyloid beta and tau together, measuring them in cerebral spinal fluid, tells us a little bit about what's happening as a result of changes in the brain occurring due to Alzheimer's disease. The test has a couple uses. It can tell or provide information about whether the symptoms someone is experiencing right now when they have the test is likely due to Alzheimer's disease or not. But it also can give us a glimpse into the future. It can also provide information on whether the symptoms someone's experiencing right now are likely to worsen. So that's really helpful information. And as we heard in the earlier talk, early and accurate diagnosis will be certainly of help when we have new therapeutics and trying to attack the disease early on. Okay, so now we're going to move to who should get tested. So it's really your doctor who should decide who testing is best suited for. So your doctor might find that they have already enough information to make a diagnosis, and adding this additional test of collecting cerebral spinal fluid through a lumbar puncture and measuring amyloid beta and tau is not needed, and they can make the diagnosis without it. There are some cases, though, where your doctor might find that having this extra piece of information could be really helpful in making a diagnosis. Generally, the test is used for people who already have some symptoms of Alzheimer's disease. It's not really meant for screening young, healthy people to predict if they will someday get Alzheimer's disease. Now, there are tests out there that have that purpose to screen healthy people to see if they get disease. So you can think of perhaps a mammogram to screen a healthy person for breast cancer. Or when you go for your annual checkup and get a blood sample collected and the doctor tests for your good and bad cholesterol, so sort of get a check of your heart health. Those are meant to screen for a disease that you might not have any symptoms for. This test isn't at this time meant for that purpose. It's really meant for people who show some signs of disease. So in summary, I hope I've shown you how we can try and measure changes that are happening in the brain as a result of Alzheimer's disease to help us with early and accurate diagnosis of the disease. We do this by taking a sample of cerebral spinal fluid via a lumbar puncture procedure, and this then perform testing that measures amyloid beta and tau proteins. We've seen that the test is very good at telling us about changes going on in the brain as a result of Alzheimer's disease, but we know it's not perfect, right? There's some overlap between those groups, as we saw. And because of that, the result is used by your doctor along with other medical information to help determine if a person has Alzheimer's disease or not. That is, it's not used in isolation as a yes or no if you have Alzheimer's disease, but is complementary to other testing performed to help your doctor determine if your symptoms are in fact due to Alzheimer's disease. And with that, I hope I've interested you in biomarker testing for Alzheimer's disease. If you want to learn more about this type of testing or testing for related neurodegenerative disorders, please visit my research lab website at demarcolab.ca. We're also running a Canada-wide study looking at exactly those biomarkers I talked about today, amyloid-beta, tau, and cerebral spinal fluid. This study, as I mentioned, is happening across Canada, including right behind me here at the Center for Brain Health and the Clinic for Alzheimer's Disease and Related Disorders at the University of British Columbia, where we're looking at how this testing impacts patients, their family members, as well as the decisions physicians are making. And you can find out more about that at impactad.org. And with that, I'll pass it back to Dean.